Namaste. Can you all hear me okay?
Yes.
Yes, Raj.
Thank you. So today, it's a surprise. You all have heard and seen Nitin Ron, my friend and a neonatologist from New York. And he has climbed Mount Everest 4 times so far. And his father is Shri Pralhad Ron, is a lifetime teacher of pranayama and practitioner. So they both have written a book together on pranayama. They'll talk more about it. And today, Dr. Ron and his father, Shri Pralhad Ron, will be speaking to us with some demo. And Pralhad sir, please don't rush. If we need, we will have another session in New Year. And this is a very fitting session for the present times. Over to you, Nitin and Shri Ron.
Thank you so much, Dr. Raju. It's a pleasure to be here and be with Dr. Raju and all of this wonderful group. The organizer, Dr. Raju and his colleagues, they are neonatologists, and I love it how we transcend all the boundaries and barriers and also go into health and spirituality and holistic medicine. I'll talk just a couple minutes about my dad. He's going to be the main one talking. Once I start talking, usually I cannot stop. So I will restrain myself with my utmost self-control now. But I'm very excited that my dad is here to talk about this. He has over 5 decades of experience in the science of pranayam, yoga, and meditation. It was very funny ever since I was a kid to be surrounded by all of these books, Autobiography of a Yogi, J. Krishnamurti's philosophy. Not that I read any of them. I was very naughty as a kid and probably just kind of like observed them in the shelves. But I think it makes a difference when that energy prevails around as well. And what is wonderful is that he is also an atomic scientist. He is actually in Wikipedia as the founder of the Star Wars program, which is non-lethal warfare in nuclear science. I don't even understand half of what I'm saying right now, but he actually co-authored a book on atomic physics. This is Dad's book. This is in the field of physics. This is done in collaboration with Jane Lair, who was the chief scientist of the Defense Research Labs in Albuquerque, New Mexico. So collaboration between the US and India. And this expounds in detail all the atomic physics, which I would never understand. That's why I went into medicine, since I sucked very much at mathematics and with most of physics and science. But it's been a pleasure to have Dad's interest in the field of pranayam and meditation, but mainly pranayam, because the same level with which he paid attention to even the tiniest atoms and molecules, he pays that attention to every little bit of the practice in the science of pranayam. So a few years ago, I told him maybe he needs to write a book, and I was so surprised that he invited me to co-author it with him. And this is a book on the science of pranayam. And this actually was published this year, early this year in India, and it's available as an online download in every other country. But it was exciting because 5 different people from 5 different countries came together to make this book happen. Myself in the United States, my dad, there is an artist from Australia who actually contributed his drawings to the book. So everything is original, the artwork. And then one of my medical students, his wife is the founder of Pinterest. And she said, Dr. Ron, I can actually, my husband told me that you're passionate about this. I can digitize everything. So she helped in digitization. So it's like how incredible. I feel that whenever there is something positive and powerful happening in the universe and you do it for a higher purpose, everything turns around and everything that is beautiful starts happening around you. On that note, as I said, as I promised that I'm going not to be talking much longer. So I am going to give the stage to my dad, and I think we are in the street to actually see this most incredible exposition on pranayam. Whatever he's talking, a lot of it is very original as a scientist and from his experience at in life. So I am excited to have my dad talk about this and if possible, do a couple of demonstrations. So I'm going to give the stage to him without further ado and have him talk. And thank you so much everybody for being present. And as I requested, if you can put your videos on because dad actually loves to see remember to keep the mute on. But if you see the faces, you said you prefer to actually, rather than names, if you can, he's fine to actually see the reaction and some feedback or whatever it is, just by nodding. So put the mute on, but it's entirely okay to put the video on and we would love to see you all. Okay, so I have to keep my promise and let my dad do the talking. Thank you so much, guys. I'm going to move my chair out of the view so he can be central.
Thanks, Nitin, for the kind introduction. As always, he is loving and kind to me. Thanks to Dr. Raju and other administrative staff of this beautiful temple for giving me an opportunity to share my knowledge and thoughts about pranayam. And I am very, very grateful to all the participants who are online attending this, who have sacrificed their so many other options and come over here. Nitin has, I think, built up a lot of expectations about me, but I really don't know how much I will be up to. Anyway, in this presentation, I want to divide it into two parts. The first half, I want to give the fundamental principles of pranayam and practices. I will also demonstrate a few practices. And in the second part, I want to give some practices which are applicable for COVID-19 infected people. Why I got into it, I had absolutely no idea that I'll be talking about the pranayam practice for COVID. But recently when I was reading in the Times of India, Indian Express of India, New York Times of US, and the Scientific American of US, there were so many conflicting views about what practices, pranayam practices, a COVID patient should do or should not do. See a misunderstanding between doctors and yogis and things like that. So I went into deep thought. It just happened last week only. Otherwise, I had absolutely no idea. Then during my meditation moments, a lot of new ideas came to me about the practices to be given to the COVID people. Because the conventional pranayam practices cannot be given to the COVID patients, which I'll be discussing in the second part of my talk. Let us see. Pranayam concerns about the science of breathing. Prana is vital energy. And ayam means regulation. Regulation of the vital energy is what is called pranayam. We mainly get energy from two sources. One is the food and the other is the breath. As you know, the energy from the food gives us the nutrition and the pranayam gives the ATP, the energy source inside our body and the mind. So it is the food and the breath which are responsible for managing this body and the mind. Pranayam is called vital energy because we can live without food for months together, but you cannot live without breath even for a few minutes. To find out the power of breath, you just close your nostrils and the tremendous energy within, after a few minutes, that force pushes your hands and the nostrils are open and the breathing starts. That is the power of the breath. Today we are going to discuss how we can tap this power of the breath for the good of the body and the mind. Just like we eat wrong food, we spoil our health. Similar way, if we do wrong breathing, we do tremendous damage to our body and the mind and our whole life itself. That is why pranayam is so important. It was about 300 years before Christ, that is about 300 BC. A great Indian self-realized scholar sage called Patanjali, he for the first time explained the theory of pranayam, and his statements were so profound and unbelievable. In his famous treatise called Patanjali Yoga Sutra, he mentioned that by slowing down the breath, when you reach a threshold of very low breath, a suspension of the breath takes place, then there is a big shift in our consciousness. Our waking consciousness, we shift to super consciousness, the intelligence of the universe. He said that could just happen by just slowing down the breath. It was really an astounding and unbelievable statement. But he never told about the techniques of pranayam. He did not explain how to do the practices of pranayam, because the pranayam creates such a tremendous amount of energy. If the person is not good, if the person is not noble, one can misuse that energy to wrong purposes. And not only we damage ourselves, we can damage the world. That is why pranayam was kept a secret. It was taught only to limited few people who had credentials of goodness. They will always think good of others and do good to the world. To only such people, pranayam was taught in Patanjali's time. Patanjali never cared for health, healing and things like that. His thing was only self-realization. Just like, for example, in the path of meditation, we articulate the thoughts, and when we bring down the thoughts to the very, very, very low level, then a shift in the consciousness takes place. That is the path of meditation. In the path of devotion, we articulate the emotions, and then a shift takes place in the consciousness. This pranayama is the path of energy path. So these are the three important methods for self-realization. So Patanjali talked only about self-realization. Then it was in about I think 1200 AD, where another great sage, his name was Swatmaram, he wrote a book called Hatha Yoga Pradipika. He said, instead of reducing the breath and going to self-realization, you can also increase the breath and tremendous benefits will come to the health and healing. It was for the first time that Swatmaram applied the pranayam techniques not only to self-realization, but also to health and healing. As you know, in all the modern yoga practices, pranayam is used for both purposes, for self-realization as well as for health and healing. Let us see how the nature taps the power of the breath to meet the multiple purposes in our life. If you just see our breathing phase mainly consists of three components. One is inhalation, when we take the air into the lungs. Then exhalation, we offload the carbon dioxide. Third is the suspension, to suspend the breath. After inhalation, there is a small suspension. After exhalation, there is a small suspension. So these are the three basic components in our normal breathing. And every component has a tremendous energy. Inhalation has tremendous of energy. Exhalation has tremendous of energy. And suspension has tremendous of energy. Let us see how the nature taps this energy of the breath. We normally breathe about 15 per minute. In 1 minute, inhalation, exhalation. If you count as 1 unit, then we breathe about 15 per minute. Now, supposing you start jogging or running, after running for half an hour, for example, what happens? You are tired. Your calf muscles are tired, hamstrings are tired, and you are fatigued. You can run no more. When such a situation happens, what the nature does, it increases your breathing rate, Instead of 15 per minute, your breathing rate will go to 60 per minute, 100 per minute, tremendous breathing rate. This is inhalation dominated breathing. Nature creates inhalation dominated breathing. Instead of the air entering into the lungs only 15 times per minute in our normal thing, now the air will be entering 100 times into the lungs. You can imagine the amount of ventilation per minute, average ventilation in the lungs increase tremendously. Normally we take about 500 milliliter of air enters into the lungs in every inhalation. So if you are breathing 15 per minute, so 500 into 15, 7,500 milliliter of air is entering into the lungs. Now when it goes to 60 per minute, 100 per minute, you can imagine the amount of ventilation, so much oxygen richness comes in the blood. And very interesting thing, when during running this high breathing and oxygen richness happens, and all this oxygen is now delivered to only where it is required. For example, it will be delivered only to the calf muscles and the hamstring. It will not deliver to other parts of the body. Only where it is needed, it delivers. So this type of breathing, high breathing, that means you breathe much more than your normal breathing of 15 per minute. This is adopted in pranayam as Bhastrika Pranayam. In Bhastrika Pranayam, we jog the various parts of the body. For example, I can jog the abdomen, I can jog the rib cage, I can jog the clavicle, I can jog various parts of the body and do high breathing. This is exactly what the nature is doing in jogging or running. Here, sitting at one place, we are jogging various regions of the body and deliver sufficient energy to the various parts. So this pranayam is called Bhastrika Pranayam, whose purpose is energization. Every organs becomes very happy. So much oxygen it gets, So its optimum working will be improving very much. Now let us see what is the power in exhalation. For example, when you are tired, you are bored, you are fatigued, then a big yawn happens, This is exhalation, very long exhalation happens. So you are offloading, when you have such a long exhalation, you are offloading tremendous amount of carbon dioxide you are offloading. Similarly in coughing, when you go on coughing, it's only exhalation, exhalation, exhalation. Coughing happens when there is a lot of toxins built inside the body. So this exhalation dominated pranayam is called Kapalbhati. The purpose of Kapalbhati is to detoxify the various systems. It removes the toxins. So repeated yawning, what I am doing now, I am repeatedly only exhaling. Very little oxygen enters into the lungs. The main purpose is to offload all the carbon dioxide. And once you offload so much of carbon dioxide, because here again, you are breathing at 60 per minute, 100 per minute, but only exhalation. You are doing exhalations 100 per minute, let us say. Normal exhalation, we do only 15 per minute. Now, if you are doing exhalation, let us imagine for 100 per minute means you can, what happens? Tremendous, the residual carbon dioxide level comes so low because you are removing so much of carbon dioxide and very little oxygen is there. So, during this Kapalbhati, that is exhalation dominated pranayam, what happens is carbon dioxide level in the blood comes down. When it goes so low, very interesting thing happens. For example, in Kapalbhati, oxygen availability is not there, but then I am doing exhalation by moving various parts of the body. For this metabolic activity, oxygen is required, but oxygen is not available. So what it does is, it breaks down to get the oxygen, because to get the oxygen, it will decompose the fat muscle. So pranayama is the most powerful means of reducing the fat in various regions of the body. Another interesting thing that happens is during Kapalbhati is when the carbon dioxide level in the blood goes very low, the lactic acid and the uric acid, excessive lactic acid and the excessive uric acid, they decompose. And as you know, fat, excessive lactic acid, excessive uric acid, these are the cause for many of our health disorders. So what happens in Kapalbhati Pranayam is you move various regions of the body and do exhalation. For example, I can do Kapalbhati with the rib cage. Then only this part will be purified. I can do Kapalbhati from the clavicle. I'm only exhaling. So it detoxifies this portion. So basically, Bhastrika and Kapalbhati, they are fast breathing practices. That means you breathe much more than 15 per minute. You can go up to 100 per minute. The purpose of this is health and healing. Bhastrika is energy giving and Kapalbhati is detoxification. Now let us see what is the third phase. How the nature utilizes the suspension of the breath. Suspension of the breath is the most powerful thing. Patanjali never talked of inhalation, exhalation and things like that. He talked of only suspension. Suspension of the breath. When the suspension of the breath happens, a shift in the consciousness takes place. From our waking consciousness, you go to the superconscious state. How it happens is very interesting to analyze. Let us see what happens in the deepest state of the meditation. In the deepest state of the meditation, your body is like a stone. You are not moving at all. Static. You are sitting like this. So there is no metabolic activity in the physical body. Then in the deepest state of a meditation, thoughts are also not there. That means the brain also doesn't need oxygen. So in the deepest state of the meditation, it is a total relaxation of the whole system. Body doesn't need oxygen. Brain doesn't need oxygen. Therefore, almost oxygen is not required at all at that time. This Patanjali called as Sahaja Kumbhak. In the deepest state of a meditation, what happens is suspension of the breath, which is called Sahaja Kumbhak. It is not the suspension which you do by closing the nostrils. That is initially one does in pranayam to train the system to get used to this long suspension. But Patanjali's suspension is slow down the inhalation, slow down the exhalation. Instead of breathing 15 per minute, for example, in sleep, what happens? In the sleep, breathing rate goes down from 15 per minute to 10 per minute. And the breathing rate has gone down. What happens in the sleep? We don't remember yesterday's. We don't think of tomorrow's. It is a deepest state of relaxation. Even at 10 per minute, it is a deep state of relaxation. In pranayam, slow breathing pranayam, you go much below the sleep stage. You go to, breathing rate can go to 5 per minute. You can even come to 1 per minute. You can imagine if you are breathing only 1 per minute, that means so little air is going into, there's absolutely no oxygen at all. Because oxygen is not needed at all in that state. So in the meditation, what you do, you articulate the thoughts and come to Sahaj Pranayam. But in pranayam, we articulate the breath. You reduce the breath, go on reducing the breath, come to Sahaj Pranayam, then thoughts and everything. Your ego will get relaxed and ego will get dissolved. That is how the shift in the thing takes place. So now I will demonstrate a few Bastrikas. Bastrikas in the abdominal level, Bastrika in the intercostal level, Bastrika at the clavicle, Bastrika at the glottis, Bastrika in the mouth, and then Bastrika at the nostrils. For example, abdominal Bastrika will be high breathing rate and jogging various parts of the body. For example, abdominal diaphragmatic Bastrika will be and intercostal Bastrika will be like this. Now I am breathing 80 per minute. So much tremendous oxygenation. Now all that oxygen is now delivered only to the organs located in this rib cage. For example, the heart, the lungs, the tissues, and all those things is delivered. Now the next one is clavicular Bastrika. One can do at medium, slow speed, medium speed, high speed, depending on one's health status, one can do at various speeds. Then, so we are energizing various parts of the body. Then I can do glottis breathing. I can do mouth breathing. By doing Bastrika and Kapalbhati at the mouth level, many deadly mouth diseases can be prevented. By doing this glottis breathing, what is Bastrika and glottis Kapalbhati? Many thyroid disorders can be removed. There was a person, when I was conducting a workshop, he had gone angioplasty. After undergoing angioplasty, he had a chest pain continuously for 3 years, He was only on painkillers and no medicines could bring down his chest pain. Then he came to my workshop. Then after undergoing the pranayam, the chest pain which was continuing for 3 years got resolved in 1 month. Unbelievable how the pranayam works, This is not an alternative therapy or anything like that. This is the primary therapy. Because breath is our very essence of our energy for the body and the mind. It's a primary therapy. And so many cases of psoriasis, workshop, psoriasis, as you know, is one of the most difficult things to solve. So many cases of psoriasis. Then sinusitis, migraine. So nasal, so you can jog the nasal channels, for example. So these are all the Bhastrika, they are energy giving. And same, all these regions can be used for detoxification. For example, abdomen, diaphragmatic Kapalbhati will be like this, series of exhalation, exhalations. Intercostal Kapalbhati will be earlier Bhastrika, what I did, it was 50% inhalation, 50% exhalation. Now what I am doing, it is 90% exhalation only. Then clavicular Kapalbhati will be, those people who attend my workshop, many times you get what is known as a frozen shoulder, frozen shoulder. All these things get solved so easily, by doing all this pranayam. Now I will have not much time to talk about this. So directly I will go to the second part of my talk about the COVID thing. COVID. What are the practices which the COVID patients should do? Because that is such a controversial subject now. See, let us see what are the medical conditions of a COVID patient. Medical conditions of a COVID patient is, one is he has low blood oxygen level is very low because the virus which is sitting at the alveoli, it is taking away all the nutrition and oxygen that is taking rather than the healthy cell. So one of the things that happens to a COVID affected person is his oxygen level goes down. His energy level goes down because all the nutrition is shared by the virus. Instead of healthy cells taking that nutrition, now virus is taking away. So his oxygen level is low, his energy level is low, and stress level is very high. He's isolated, he's away from his near and dear ones, and he's worried what is going to happen tomorrow and things like that. So his stress level is very high. Once the stress level is so high, there will be a lot of secretion of stress hormones, and his immunity level goes tremendously down. Both the innate immunity level and the adaptive immunity level, entire thing goes down. So such a person who is having low oxygen, low energy and all that, how can he do Bhastrika and all that? They're very energy intensive things, So much energy is required to do this Bhastrika, Kapalbhati and all that. So these things are simply, he cannot do. And it will be harmful if you ask a COVID patient to do Bhastrika and Kapalbhati and things like that. Now let us see. So these fast breathing pranayams are rolled out. Now what remains is slow breathing pranayam. But we cannot use slow breathing pranayam also to a COVID patient, because in slow breathing pranayam, oxygenation will be reduced like anything. Because instead of breathing 15 per minute, you are breathing very, very slow, 5 per minute you are breathing and all that. So if we start giving the slow breathing practices to a COVID thing, already his oxygen level is low, it will further reduce his oxygen level. So you cannot use slow breathing practices also. So that is why a lot of thoughts came to me the other day, So I modified all these things to suit the COVID patient. For example, I want to take some water. See, there are two very simple breathing practices known as Sahaj Pranayam. In Sahaj Pranayam, you do deep inhalation, deep exhalation. For example, standard conventional pranayam will be like this. This is Sahaj Pranayam. In this slow breathing pranayam, we are not voluntarily moving various parts of the body, but the same slow breathing pranayam, if you start moving various regions of the body and slow do slow breathing, then oxygenation will start happening. It is both a stress buster as well as oxygen enhancer. For example, the same Sahaj Pranayam, I can do it this way while the chest is taking a walk, for example. You can't jog and you cannot run, but you can walk very nicely. So the chest can nicely move up and down like this. Same Sahaj Kumbhak I can do like this. Now the same Sahaj Kumbhak I can do with abdominal thing. So here, what is happening here is gas exchange in the lungs is increasing because of these voluntary movements. For example, I can do with clavicular slow breathing, same Sahaj Pranayam I can do like this. This is all COVID affected people can do. And I have actually devised so many other pranayams, which if given to COVID affected people, I think they should recover very fast and they can come out without going to the ventilator. So in fact, I have written up a 3-page things of the various other pranayams that can be given to a COVID affected person, which I think should help him tremendously for fast recovery and his time to be spent on ventilator will be reduced. So unfortunately, I have run short of time. So I am very sorry. Now, whatever I wanted to deliver, I could not do because of the short time. Because mainly my stress today was to talk about pranayams for the COVID, because that is the most controversial subject. I stop here. Thank you so much.
Thank you so much for explaining this part of Hinduism and its application in life. Over to you, and you can moderate the questions. Nitin?
Yeah, sure. Yeah. So we can have, thank you so much, Dr. Raju. And this was a very beautiful recitation, Anup. Thank you so much. And we'll open it up to questions.
Yes, I have a question. Good evening, sir. Namaste, everyone. You told about COVID patients, and I'm the person who affected for the COVID, and I admitted and treated for pneumonia and everything. I'm fine now. Do you have any suggestions for me to go through whether I have to continue what I was doing, Badrika and Kapalbhati and everything, I have to reduce anything?
No, you can definitely, if you have recovered totally, and if you are feeling quite energetic, and if you can do these Bhastrika, Kapalbhati and all that, but you need not, I think, go at the full speed. You start with the medium speed, like this, for example. Like that, various parts of the body, you can do Bhastrika and Kapalbhati at low speed, medium speed, and as and when you recover more and more of your lost health, then you can increase the speed. I think that should work wonderfully for you. I feel so.
Okay. Thank you.
I had good. Oh,
That's, yes.
Actually, I want to say thank you so much, Dr. Nitin and Pralhad ji. I'm so happy. I was waiting all day to come and listen to you. Today being such an auspicious day when Jupiter and Saturn, the great conjunction, it's also said that, as I'm a nun in the monastery practicing Tibetan Buddhism, and it says this is a very auspicious time to practice pranayam, your meditation, and so on. But I also want to say thank you for writing that excellent book. I've been following and I've been reading, and I've also been practicing. It is so beautifully written. And I also wanted to ask you if you could show me a little bit of anuloma, how you do it, in a short version. Thank you so much.
Yeah, Anuloma is the most important pranayam, I consider is as the best pranayam among all that. See, what happens in our nature, what he has done, it has made our exhalation slightly longer than the inhalation. But in Anuloma pranayam, you make the exhalation very long and inhalation very short. And to do that, what you have to do is, you have to inhale from both the nostrils. The amount of the air which is entering into the lungs is now entering through both the nostrils. So it will take a shorter time. Now, for exhalation, since we want to make the exhalation longer, you have to exhale through one nostril. Inhale through both the nostrils, exhale through alternative nostrils. I'll show you just one round of that. When you do series of these things, this is such a complex pranayam, you know. You're all the time thinking which nostrils you are closing, from where it is entering, is it coming from both the nostrils or is it going from left nostril? All the time it is, mind cannot wander yesterday, tomorrow. It will be all the time on the breath to find out which nostril you are closing, from where it is coming and all that. So the mind becomes extremely powerful, you know. It becomes such a powerful thing, and all our mental, it is a wonderful pranayam for reducing our psychological disorders, you know. At the time we think of the past and the future, which have no reality, in fact. So never in the present moment. It is always in the present moment. There is no breath of yesterday or breath of tomorrow or something like that. Especially this Anuloma Pranayam, your mind is with the, it is like a breath meditation itself. Buddhism, they talk of the breath meditation. This Anuloma Pranayam is a breath meditation by itself. It's a wonderful.
Thank you so much, Pralhad. You're such a treasure. Thank you. Thank you.
Any further questions?
Yeah, good evening or good night to you. I'm speaking to you from the Netherlands. So it's very late here, almost 3 a.m. But I'm very grateful that I could listen to you. Thank you very much. I have a question. What are the long-term benefits of practicing Bhastrika and Kapalbhati pranayama? Can you tell a little bit about that? And also, I would like to know from you how long do someone has to practice every day? Because I think it's a everyday practice, right? And not just once a week or something like that.
Yeah. See, by practicing Bhastrika and Pranayam, you are getting energy to all the parts of the body. Since you are doing Bhastrika in various regions of the body, every organ, right from the pelvis up to the top of the head, every organ, every muscle gets energy and it gets purified. And most important thing that happens is our lymphatic immunity system. The lymphatic immunity system, it doesn't have a pump like the heart. The lymph vessel, the lymph fluid has to flow through the lymph vessels only because of the movements of the breath and the blood circulation and all that type of thing. In Bhastrika and Kapalbhati, you are moving such a rapid movements in the various parts of the body that the spleen which is in the abdominal cavity, it gets very active. Spleen, as you know, is a very important part of our adaptive immunity system. So that gets energized. The lymph vessel, the lymph node, the lymph organ and lymphocytes, which are for fighting the thing, they all get totally at the super performance they will be getting. So this Bhastrika and Kapalbhati, if you regularly do, I think we can almost get rid of most of the existing diseases and not allow many other things to come. Because if all our organs are very healthy, innate immunity system will also increased tremendously. So this Bhastrika and Kapalbhati, they are very important pranayam. And each of them should be done for 3 minutes. Because for the blood chemistry to change, it takes 3 minutes. Heart, as you know, is very small. It can hold only a small amount of the blood. But entire blood in our body is very large. All that blood has to pass through the heart, it takes 3 minutes. So if each of these, if you do for 3 minutes, then you are changing the entire blood chemistry and the oxygenation and offloading carbon dioxide. Because of this, whatever the advantage is coming to the blood chemistry, now it will all come if you practice it for minimum of 3 minutes. More than 3 minutes, it may not be so much advantages. Less than 3 minutes, you will not get the full effect. 3 minutes is the optimum time.
Thank you very much. I will practice like this. Thank you.
Thank you so much.
And there is also a very informative YouTube video that I uploaded of my father's. So if you just put his name on YouTube, Pralhad Ron, it's a 58-minute video. It gives details about downloading the book as well, all the web pages. But just put his name out there, and that has the practice in detail. And it's a whole hour of explanation, and it's really a pleasure to watch. It was in a beautiful art studio by of a very well-known artist, and I would recommend, if you have the time, definitely to put the name Pralhad Ron on YouTube. And one of the things that pops up is that 1 hour of teaching that that he did, which we loaded up.
Nitin, can you please spell Pralhad?
Yeah, he spells it differently. So I'm going to I love talking, but he needs to spell his own name. So I'm going to let my dad spell it.
It is actually Pralhad, Pralhad. Normally it is written as Pralhad, HLAD, but I write LHAD, Pralhad. L comes before H.
So yeah, so put in Pralhad Ron, and then the details of that one come up. And Dr. Raju, the one who was talking just now, it's interesting. He and I are actually writing a paper. This is in partial reference to both Ravi Kishore's question and Burns' question. We actually compared pranayam to the ventilatory strategies that we use to ventilate tiny babies. So how these breaths actually sync with the time frames that we use for ventilation, as also, we use it in mountain sickness to prevent that. We use it's the Lake Louise criteria is what it is called, but we technically use the equivalent of pranayam. I've been on Everest 4 times, and it has really been incredibly beneficial to increase the lung capacity. And even pregnant women delivering a baby, we actually have advised a variant of it. So it's incredibly scientific, and this is a beautiful opportunity. Here we are exploring the interface between holistic medicine, spirituality, and science as we know it now. So all the more exciting. And maybe, Dr. Raju, how much time do we have? Is there time for a question or 2 more, or are we wrapping?
Yes. And thank you, Nitin. So hopefully that abstract will be accepted. There are many doctors in the group. They do understand the ventilatory rate, the inspiratory time and expiratory time, and so on, what we do. Okay, so we can take up 2 or 3 more questions. And can we wind up in the next 10 minutes? I know there are more questions. Dr. Nair? Dr. Nair, we need your permission.
By all means.
Thank you.
So, and Dr. Pralhad Ran and Nitin, I know it is very difficult with your schedule, but we would like you to come again and again and even do some demo sessions. As you can see, there are about 40 participants, and they'll be looking forward to. And unfortunately, we cannot fix a time because it depends on Dr. Ron's NICU call schedule as well, like mine. Thank you. More questions, please. And please limit to 1 question per person.
Jim, you have a question. Yeah.
Is there a better one to do in the evening, like before you're going to bed? I mean, this is all energy producing, but what if you want to slow down?
So anything before going to bed? Is there a pranayam which will relax you rather than energize you?
Yeah. The best pranayam is the slow breathing, Anuloma Pranayam. Because in Anuloma Pranayam, exhalation is very, very long. What happens during exhalation, the heart rate goes down, And during the inhalation, heart races. So when your exhalation is very long and the inhalation is very short, you are slowly getting into deep relaxation. The heart will start getting the deepest rest. And once the heart gets the deepest rest, all other parts also will be getting the deepest rest. So the best, according to me, is the Anuloma Pranayam, where you inhale with both the nostrils, exhale with alternative. If it can be done for about 15 minutes, I think it will be a wonderful pranayam. It will relaxation both at the physiological level, at the mental level, psychological. All the three levels it will relax. In fact, the ego will first relax and ego will slowly dissolve. I think that is the best pranayam according to me.
And Jim, this has been of practical benefit to me as well. If I'm on call in the neonatal unit, our weekend calls go to even 24 hours and it can be very busy. So even if I have like a 15-minute break, then instead of trying to sleep, you don't even get the sleep. If you can really do the slow pranayam and entirely center and relax yourself. So if I have to run for a cesarean section of a premature baby in the next 5 minutes, I do find myself much calmer, cooler, and much more energized when you do it. So it really helps to settle you down. So I think these really, they have worked for me over the last several years as well. So I would definitely say that, it has its place in relaxation, not just in energization. Thank you for that answer.
I have a question.
Yes, please. Yeah.
In COVID, the way the COVID virus attacks the body through spike protein, which is in the nose and the lungs. And, people ask why the COVID rate is lower in India. And I was thinking one of the explanations could be that a lot of people do Bastrika and Anuloma Viloma, and that might be displacing or not allowing the viruses to tag into these proteins. What do you think?
I don't think. Because this COVID virus will not directly go to the air. It has to enter through the cellular thing. It has to enter into the respiratory thing through the internal journey. It cannot be going through the respiratory air. It cannot be entering through the air into the alveoli. That's what I feel. I don't know.
But I think it is definitely something which requires study for sure, because it's so multifactorial. I think one thing we have been humbled so nicely in the medical profession since March, April, I have been in New York and I have seen it at its peak devastation. Many times I've broken down and cried when I've come home after seeing these freezer trucks and the bodies being loaded in it. And this amount of humanitarian disaster, we have not been prepared for it. And so I think there is a lot of to study about the virus. And who knows, yes, it is definitely lower in, it looks like they are bearing it such a lot better. And, there's less serious effects in India, as well as the percentage population is less. Difficult, I think it might increase the lung capacity by itself, the regular practice of pranayam, and this renders you healthier. But even if I attempt to give an answer to that question too, I think we know so little about the virus, but all these are fields for study. They are actually teaching COVID patients for prevention as well as for treatment, in the vulnerable areas. So there, Anup, you might have a point. But at this stage, it's hypothetical, but definitely we should study it more to see how much we can learn from it.
Thank you. Thank you.
Thank you. Maybe time for one more question if anybody has it, and then we could wrap up.
Yeah, I have a question. When you're trying to meditate, right? The breath becomes very low, and then after some time you fall asleep. How do you prevent that one?
Yeah, that is the problem. See what happens actually, once you go on slowing down the breath, two things will happen. Either we sleep or we get self-realized. So
how do you prevent sleeping?
So both are deep relaxation states. So that is why it is very important during meditation. We have to be all that we should, as soon as the sleep starts coming, we have to be observe that now my meditation is going off. You have to be all the time alert that you have to awake all the time. Then it will take you to the superconscious. Otherwise, we sleep.
Very easily sleep.
Anyway, it is good. Many people who don't sleep properly and all that, it's good for them.
Yes.
Can I consider
Yes.
that as yoga nidra?
Is it a part of yoga nidra?
Yeah. Yes.
It helps you sleep.
Yes,
Sure, it
yes.
can do that.
It is. In fact, nidra, sleep, is so important from health point of view.
Yes.
Ya Devi Sarva Bhuteshu Nidra Rupena Samsthita. It is such a divine power to have good sleep.
Yes.
And also to go back to Anup's points scientifically, Dr. Ron and Pralhad sir, if you may excuse me, there is no doubt that slowing the breath will reduce the heart rate, will reduce the blood pressure. And there are some who say that it increases endogenous nitric oxide, which selectively dilates the airways. So that is yet another point. And some say, you can tell me whether this is right or not. I heard somewhere that our life is counted in number of breaths. So if you slow down, the longevity will be increased. Can you please talk about it?
Definitely not. If our life is fixed, lifespan is fixed by the number of breaths, then all exercises, treadmill, everything gets cut out, because you are breathing so fast on the treadmill, running, things like that. So,
and I think with that note, we had to call it a Shubharatri.
okay.
we will invite Pralhad ji and Nitin again, and please come again. And this is a very lively audience, and we look forward to listening to you and seeing your demonstrations again and again.
Thank you so much.
Yeah.